One thing I have noticed about young people today is that quite a few of them seem to get into psychology, which when my generation was studying in college, we didn't seem to have as much of. So today we have Maalvika Bhuvanasundar, who's an early forensic psychologist working in suicide prevention in Bangalore. In 2016, she was diagnosed with Crohn's disease. I'll check if this pronunciation is right. Due to her extensive experience with the illness, she has become an advocate for mental health and its impact on individuals living with chronic illnesses. She is currently the mental health and peer support lead at IBD Patient Support Foundation. She was a fellow with the Crohn's and Colitis Young Adult Network in 2022. Her areas of interest include suicide prevention, health psychology, offender behavior, rehabilitation, and counseling. That's a heavy load to carry for someone who's so young. So, this is the My First Job podcast, episode 104. My name is Venugopal. I head Ideascape, which is into branding, creative, and design. And these career journeys that we talk about every week with our guests is about helping you understand what are the options available in careers and for you to decide whether these are the things that you'd like to proceed with. I understand that this is a fairly strong subject to start on the new year with, but that's the time when we make all our resolutions, right? So let me welcome Malvika to the show. Hi, Malvika. Great to have you on the show.
Hi, Venu. Thank you so much for having me on this show.
Okay. So uh, you have actually gone through quite a bit. And I'm wondering if, what you have been through has defined your career choice, or is it that you had some other career in mind and then you decided that, no, this is where I think I'll make a difference?
So, ironically, I didn't have this diagnosis when I chose a career in psychology. This was right after I started my undergraduate degree, to be honest, few months into my undergraduate degree. I was always interested in psychiatry. So my initial plan was to do MBBS and do MD in psychiatry. However, science was not something I was scoring well or really good at or interested in. So, but I still didn't want to leave that passion of psychiatry. That's when I got to know you have something called psychology, where you don't really have to take science in your 11th and 12th. You can even take humanities, but you need psychology as a subject. So I was like, that's great, that's perfect. And that's how the whole idea of psychology came into, because I felt there's nothing more stronger than understanding the human mind and behavior. And I feel that was so fascinating for me at that age. At that age, I was not into making a difference. I was like, I want to do something interesting, something different, something which, if I can understand somebody's behavior and use that to my advantage, then why not? That was my initial thought process of choosing psychology. But then understanding the complexities of human behavior then got me passionate into actually helping individuals who go through things in life. So that's how the journey for psychology began, actually.
Tell me a couple of experiences or, what happened while studying psychology. What were some of the things that were revelatory?
Right. So initially, when you choose psychology in your 11th and 12th, it is just basic psychology. You don't really get into the different kinds of psychology per se. That comes a bit later on. But something that really stuck with me is how mind, a lot of individuals don't consider the mind as a part of themselves. It's always your physical body, and mind is just an entity. But the more you study about it, you realize mind is so much a part of your body, just like your physical body. In fact, if things, because you can't really see the symptoms, you can't really address them, which is so much more scarier, right? Because if I have, like a fracture, you'll immediately go and see a doctor because you can physically feel it and you can see it. But when there's a fracture in your mind, you're not really doing anything about it because it can't be seen. and you just let it be, and things get so much worse. So that's one of the first things we studied about psychology, like the stigma about it, and how important it is to actually address these things. So I think one of the few things that stuck with me is how stigmatized this whole field is, and how by becoming a psychologist, I can help, reduce the stigma around it. So I think that is something that just stuck with me about psychology at that point.
So, did you have some amount of practicals? Were you in the room when patients were being spoken to or counseling sessions? And
Mhm.
do you remember something that struck you very strongly at that point?
So since I did my education and my first job was actually in Dubai, the United Arab Emirates, there it's not allowed. So you cannot really be in, when you're still studying, you can't be in a therapy session because of confidentiality. So they wouldn't really allow you to do that. However, during my master's, I did get that opportunity. And I think one of the first cases that I was a part of, I couldn't sleep for a week because it just stuck with me so much. I carried it back home with me, and I would try to distract myself, but while going to sleep, things would just run in my head. And yeah, I think at your initial stages of the career, things just stick with you, especially your first cases. And when I started practicing, I think one of my first few cases was around suicide. So that was something that really stuck with me, and I felt responsible for that person, because you have someone suicidal with you, you know the end outcome if you don't do your job properly. So you are always in that fight or flight mode, and this guilt is always there with you. So I think initial stages, things really stick with you. I can't share details of the case because of confidentiality, but yeah, it's very difficult to find that balance where you can just keep that aside and look at your life as well. Yeah.
So, you opted for forensic psychology. Can you tell us what forensic psychology is and what
Yes.
really
Yes.
happens?
Yes. So forensic psychology is the intersectionality between law and psychology. So essentially, you're going to be working with individuals who have been offenders, who are in prison serving their sentence, or you're going to be part of courtrooms as expert witnesses, or you'll be at the policy stage where you are going to rewrite mental health policies in the context of law and offending behavior. So I was also interested in law. There was one point where I wanted to pursue a career in law and become a lawyer. And I was also still passionate about psychology. That's when we had like a career fair in our college where I got to know about this field called forensic psychology. So I was like, this is like the best of both worlds, where I'm a part of law and I'm also a part of psychology, working with individuals who are the lawmakers or the offenders, judges, people like that, working with politicians at the career, at the policy level. So forensic psychology is everything that involves law and psychology. So,
So, what happens in this intersection between law and psychology? Is it that these interviews aim at an understanding of why the crime was committed or why people become that way? And ultimately, who pays for this? How are you compensated for the time spent?
right. So, since I did my master's in UK, I think I'll be able to explain it better in that context. So, you have different potential of being a forensic psychologist. One, yes, you are working with people like the CID, crime branch, and people like that to understand why these crimes happen, what could be the motive behind it, and also trying to figure out who would have done it based on psychology, especially if there's a case of homicide or serial killing. Then definitely a forensic psychologist is called in to understand the psyche behind the crimes that are happening. Another essential, crucial part of forensic psychology is rehabilitation of the offenders. So, in countries like UK, US, Canada, they believe in rehabilitation over punishment. India still believes in punishment over rehabilitation. So, essentially, what happens is they want to release these people back into the community, but how to ensure that they wouldn't recommit the crime. That's where forensic psychologists come in. They provide therapy sessions for the offenders, and they sign off at the end to see if they can be released back into the community. And because ultimately the goal is to reduce the crime rates, so you cannot keep everybody in prison, you can't overflow the prison, so you would have to release people back into the community, but you cannot guarantee if they will recommit the crime or not. That's where therapy comes in. And research actually shows that rehabilitation works better than punishment, because individuals who are released back into the community post therapy are less likely to recommit the crimes. So I think that's a crucial part of forensic psychology, which in India, I think Tihar jail is actively pursuing that. They believe in rehabilitation. They have juvenile rehabilitation centers and things like that. And compensation comes to the government level. So in India, at a private organization, you're more involved in research. Forensic psychologists are mostly involved in research, and they also go into organizations, where they hire people and they're based on that. So India still booming in the field of forensic psychology, but Tihar jail, Delhi, they actively pursue and they hire forensic psychologists because they have rehabilitation programs in their prisons. So government
Okay.
usually funds. Yeah.
Okay. Great. So you're listening to the My First Job podcast. All, since we're talking of suicide prevention, all standard disclaimers will apply, and people who are affected need to take special care and understand the implications. And I'd like to now take you to um, what are the kind of cases, without mentioning names, of course, or any context, what are the kind of crimes that you have seen, and how do you see what is it that you found surprising?
Right. So one of the first cases that I have gotten in during my master's was of sexual assault. So trigger warning for anybody who would have been affected by this. We're going to talk a little bit about sexual assault here. So I was very biased towards it. I did not want to work with such people. Also because in India we hear so many cases and things like that, you're automatically biased towards that. So for us, punishment is the only solution for sexual assault. We cannot think of anything else or even interacting with such individuals because the crime is so heinous in nature. You don't really want to interact with them. However, one of the first things they made us do in our field was tackling the case you have bias towards to understand if you can really work with those individuals. They will not force you to do it if you're uncomfortable, but initially they would encourage, just interact with them at least to understand things. So in the UK, how it works, the therapy for sexual assault is usually group therapy because there's a lot of stigma and shame attached to it. They have it as a group therapy because if even one individual opens up, automatically others also start opening up. So since it's a group therapy session, we just observe the session because we are students, and our professors, they're the facilitators. They're facilitating the session. Honestly, the kind of guilt and shame that the offenders had experienced, I was taken aback because I felt they felt no remorse. They had no guilt, no shame, because what are they getting out of sexual assault? Nothing. Because even murder, robbery, you can understand the end outcome, but sexual assault is something that you just can't justify the end outcome, or you can't even think about why they would have done that. But they felt so much guilt, and they actually said if they were given a chance to take this back, they wouldn't do this again. So in a way, because therapy brings that part out to understand why you did this. And they also have this role play session where the psychologist, we become the victim and we are having them face what they have done. So at that point, I actually saw them breaking down into tears. And if they ever got this chance to speak to their victim or take this thing back, they would actually take it back. So I think that stuck with me. And even research surprisingly showed that sexual assault is one of those crimes where if you provide therapy, they will not recommit it. So they have the highest least recidivism rate. So the likelihood of them recommitting the crime was very less. However, I still could not come out of that bias. So I finally chose to never work with that population because I think also, like, being from India, being a woman and seeing these things happening on a very daily basis, to not just women, even men face that. So seeing this happening on a daily basis, I felt this is something I cannot work with. This population, I will never work with them ever. So, but that really stuck with me to see they also felt guilt and remorse, because that was something I never understood, if they even feel bad about what they did. So yeah, I think that was
Yeah.
one of the few things that really stuck with me there.
And apart from the psychological implications, there is also a lot of the legal aspects for anybody who's, a sexual offender. There are
Yes,
very definite conditions. So there's a kind
yes,
of stigma even after once they've been branded as sexual offenders, then no matter
yes,
how much of reform comes in their minds, there is
yes,
always this hint of suspicion. And like you said, it was hard for you to overcome the bias in spite of the
yeah,
fact that you've had all the education and the uh,
yes,
these are very tough problems to solve, and there's so many
definitely,
layers to each one of these things which happen. So
definitely.
I mean, you have movies which deal with it, but I think people who are working on the ground understand what the implications are. Do you think that there
Yeah.
has been a change for the better in understanding it? Yes, I suppose understanding it's better. But
Mhm.
is there a difference between how these people are finally integrated into society, or do you think that that's a long road?
I think in India, it's a really long road because till now, I think it's because we still function on punishment. So for I think even in terms of punishment, they are not given the right duration of punishment. You see a lot of cases where they're released early and released on what basis? What have they reformed? What have you done in the prison setting that you truly understand that they wouldn't do this again? So I think in India, it's still a long way to go to even integrate them into a normal society. In places like UK, they have a special community for them, so they're not really um, released into society where they can interact with individuals on a daily basis, but they have like a separate society for them altogether. But in India, since there is no rehabilitation, there's very limited rehabilitation. So there's I don't know on what basis are you even releasing them, who's doing the checks to release them, and how are you guaranteeing that they are not going to do this again? Because I think our legal system is so skewed that there is no proper things in place. So it's a very long way to go in a country like India, definitely.
Okay. Uh, so your first job was into what? How did it come about? You finished your degree in
Yeah.
psychology, and then what happened?
So I finished my degree right during the COVID period. So I had to come back from UK back to Dubai. So past for the past 20 years, I've been living in Dubai, UAE. I just recently moved back to India last year. So ironically, so in UAE, you cannot work in the forensic psychology setting unless you're an Emirati, an Arab, because they do not want an expat to know the how the things are working at the grassroots level in terms of law. They will not want you to know that. So they're very protective about their country. So unless you're a citizen of the country, you cannot work in that setting. But an expat cannot become a citizen in UAE. You'll only be a resident. You will never get citizenship there. So my first job was actually in a neuropsychology setting. So I was working in a clinic that did EEG therapy for mental health and mental illness. So I was working in a neuropsychology clinic in UAE. So not really forensic psychology, but I was in a neuropsychology clinic. It was very neurons, electrons based work
Okay.
that I used to do. Yeah.
So where is EEG therapy normally applied? To what kind of
Um,
conditions?
yeah. So EEG is actually it can be applied to a range of therapies, but I've seen it being most effective for ADHD and anxiety. I've seen EEG therapy being very, especially for children, because their brain is still developing. So at that moment, when you're targeting these areas where ADHD is prevalent, EEG therapy is extremely helpful for that. We can see that their attention has increased, hyperactivity has reduced. Of course, this is in line with other therapies as well and medications. It goes hand in hand with them. You cannot do just EEG therapy. You need counseling, and you will also for things like ADHD, you take medications as well. So it works really well with children with ADHD and also anxiety. Adults who come with anxiety, I feel EEG therapy has really worked to reduce anxiety. Again, as it has to go in hand with other cognitive behavioral therapy, talk therapy, medications if you're taking that. So it's always interconnected with each other. You can't separate one from the other. But I've noticed it's very helpful for anxiety and ADHD.
Okay. Let me ask you a tough question, which is that,
Mhm.
uh, we used to think that as people's basic needs were taken care of, you
Mhm.
had the old Maslow hierarchy of self actualization.
Yes.
But we've now found a point where, when everything at a material level is available to people, the deviations seem to be in terms of sexual orientation, in terms of gender understanding,
Yes.
in terms of homosexuality, in terms of people don't seem to understand how to navigate through things like this. So has the entire uh, you know battlefield, I hate to use that word, but it's really a kind of thing where you assume that once people had the basics in life, that is, they were fairly well taken care of, they came from a
Mhm.
family which is okay, and they didn't have too much of stress at home or whatever it is, there were still problems like this, which parents of today's generation don't seem to know how to cope with. And the persons themselves, for example, gender anxiety or understanding why they are who they are.
Mhm.
How do you navigate, or how do patients of this navigate?
So, ironically, the whole problem about the LGBTQ plus and sexual orientation is also because pre-British period, India was very open to this culture. India was very accepting of the LGBTQ plus culture. If you look at the Hindu scriptures, you have a lot of same-sex individuals. We used to worship the transgender, the Hijra community. As Indians, we used to worship that. But this became something as not normal. It became denormalized post the British invasion. But now you see those countries are way ahead and way open and liberal about these things, and India has gone backwards, whereas India was one of the first countries to normalize and worship these individuals. So right now, because we have put this tag that this is not normal, that's where the problem comes in, because every individual has the right to love who they want to and be who they want to. I think the moment you take that right away from them, that's where the problem starts. And if you think about when their needs are taken care of, actually the basic level of self need and self care, when they cannot express who they are, then the needs are actually not taken care of, right? If you think about it, because they are hidden, they cannot express who they are because they know society won't accept them. Parents are very less likely to accept them when they open up about their sexuality or gender. Then how is their basic need itself is not really, because they're living a lie. Their life is a lie over here. So when we have patients from the LGBTQ plus community, we have something called queer affirmative therapy. That's a new upcoming branch of therapy that is coming up now, where we are trained to deal with individuals with such complexities. And ultimately what they want is a safe space where they can talk about their concerns and have someone who listens to it. And there's also this, I think a lot of mainstream media is also portraying, we have gone ahead in portraying the LGBTQ plus community. But I feel people are also pressurized because of the mainstream media, because sometimes they show only the happy part of it, or they show really triggering parts of it. So as young individuals who are seeing that and growing up, either they'll be extremely terrified because they're like, what if this happens to us? And but B, they're also, it becomes normal for them because mainstream media is showing it, so they have representation in that sense. But unfortunately, I think India still has a long way to go in these terms for the LGBTQ plus community, which is very sad because we were so accepting of them pre British period, and right now we have gone so backwards. But I think Tamil Nadu as a state is doing a lot for the LGBTQ plus community. If I'm not wrong, I think around 5 to 10% of MNCs have to have gender diversity, where they'll have to hire people from the LGBTQ plus community. So Tamil Nadu as a state is really trying to destigmatize, the stigma towards the community. But I think as a nation, we have a long way to go. But yeah, there's a lot of mental health challenges these community members face, because acceptance is a big area where they have issues in, and when you cannot accept yourself, it's a very tough battle that they face. And I think we really need to be more empathetic with them, because yeah.
Yeah, and in the US, what I notice is that the discussions are around which bathroom should they use, or can they take part in certain games.
Yes.
Now, that it is necessary. I'm not saying that it's
Yeah.
not a practical issue, but we seem to be caught up in the minutiae of how to deal with these things rather than the safe spaces. And what exactly do you mean by safe space?
So safe space is a what we mean by that is that there's no judgment involved. Whatever the client tells you, even if we have bias towards it, we are not judging them at all. That's the key that's one of the key competencies with thought and therapy. Irrespective of what the client may tell you, they might have done something terrible, they might be facing something terrible. We do not judge them. So this is an area where we are helping them figure out how to cope with their lives. So there's absolutely no judgment involved at all. And if as therapists we feel we cannot overcome that bias, we automatically refer the patient, the client, to someone else. Because if we're going to continue with that bias, where on the back of my head I'm continuously going to be judging them, I cannot help them at all. I'm not going to help my client come out of their struggles or cope with their illness. And I'm just going to be in this, I'm just doing it for the sake of it. So one of the key things with autumn therapy is unconditional positive regard, where you are not judging them at all. They can share their experiences, they can explain whatever they want to you without any fear of judgment. So that's a safe space where they know they're not being judged, so they can open up to the maximum capacity.
Yeah. In fact, that's the part which I find a little, you know, difficult to understand, that typically sexual orientation or whatever people have is limited to one part of their life. It doesn't affect 90% of who they are as individuals, because you can still talk to them in any form. It really doesn't make a difference. So why is it that that becomes such a defining aspect of their personality? Is something which is hard to get your head around, because I understand it is difficult, but what's your
Actually,
take on that?
to be honest, it does not affect just a part of their life, it affects their entire life. Because just a hypothetical situation, if I identify as a man, I'm a cisgender female, I identify as the same sex I was born with, but if I don't identify, you face something called gender dysphoria, body dysphoria, where you don't like what you're looking at, you just feel so disgusted with your own self, and you cannot, when you cannot accept yourself, you're not going to accept other parts of your life. Like,
Okay.
your whole, you're not, you don't like the person you are. Only once you start accepting the person you are, then can you move forward in other aspects of life, because you're gendered differently. Even when you're working, you identify as a man, but somebody else is gendering you as a female because that's what you look like. So that has a lot of mental turmoil or trauma for them. So it's it's very easy for us being on this part of the spectrum to say that it's just a part of your life, but no, not really, it's actually their whole life, until they're able to accept it, come out and take steps to become that part of themselves. They go through a lot of mental turmoil, and it gets very difficult to hide that part, and having to live life normally, yeah, it's a very difficult
Okay.
struggle.
Yeah, my ignorance is really showing, because I looked at it from the point of view of someone who's always accepted that there are two, maybe three sexes. But this whole thing of a crossover of people not understanding who they are, and it's probably hard to get your head around, because you're hearing this for the last 10, 20 years. It's not as if it's a mainstream thing, and it's only now coming into the mainstream. So when people begin to talk of things like this, I guess it takes a while before you can understand what the issue is, and then what a safe space is, and why is it that it doesn't matter, you know. So typically, how does body dysmorphia or the other things,
Definitely.
how is it treated?
It's actually a very long process. You have multiple modalities of therapy that work towards it. I feel CBT, I think, is primarily used cognitive behavioral therapy, works towards that. So it's, body dysphoria is something that takes a very long time to let go of. Anything that does with disordered body image, even if it's not with your sexuality, if you have like disordered eating, disordered body image, like it's a very long process. And there's a new modality of therapy called acceptance and commitment therapy, where you help the individuals accept these areas of themselves. You don't see it as a problem, you see it as a part of you, and then you go towards healthy coping skills. So I feel treating body dysphoria, treating gender dysphoria, treating body dysmorphic disorder is a very long process. It takes over years to get through that. But I think the first step is when an individual comes for therapy, already a big step is taken, because they've accepted there's something that's wrong, something that they really want to, wrong in the sense something that is going on with them and they want to cope with it healthily, and they're coming for therapy. That's the first step already in itself. When individuals come to therapy, it takes a lot of strength for individuals to identify something is going on with them, that's something that they don't want to live like this anymore, and they're taking that step to come for therapy. So when they accept that, that itself is a step big taken. And then that's a therapeutic alliance between the therapist and the client, and it's a slow process. There's a lot of homework involved, there's a lot of different modalities involved, and it takes time, it takes over years, but automatically the part is still there. You don't get rid of it completely, but how we help them is coping with it healthily. Instead of getting into unhealthy coping habits, we help them cope with it healthily. So I think that's where therapy really comes in.
Okay, thank you. This is the My First Job podcast. I'm talking to Malvika, who's a forensic psychologist, and she does a lot of work in suicide prevention and many other behavioral issues. So, subscribe, share, and if you're interested in a career like this, I'm sure that what Malvika is saying has a lot of bearing towards the kind of career that you'd probably want to choose for yourself in future. Okay, so Malvika, are you okay if I ask a couple of questions about your battle with your own autoimmune disorder?
Yeah, sure, you can.
Okay, so what is it like when you were first diagnosed and how did you come to terms with it? If you can
So,
explain what Crohn's disease, how do I pronounce it, and then
yep,
sort
yeah,
of expand on that. Yeah.
yeah, you're pronouncing it perfectly. It's Crohn's, called Crohn's
Okay.
disease itself. So Crohn's disease is a kind of inflammatory bowel disorder. IBD is an umbrella term for Crohn's disease and ulcerative colitis, two of the most common forms of IBD. So essentially, what it means, it's an autoimmune condition where your body is attacking its own self. That's what autoimmune means. And there are a lot of autoimmune disorders. There is psoriasis, there is Hashimoto's thyroid, there is, I think there are a lot of autoimmune disorders that come into this. So Crohn's is the inflammation of the intestine. So because your cells are attacking its own self, there's inflammation in your intestine. So because of that, there is a narrowing in your intestine. The food doesn't pass through easily, because of which you cannot eat, you lose a lot of weight, you have to constantly use the washroom, you are anemic because there's a lot of loss of blood. So initially, when I was, I think one of the most red flags which caused my family and me to go and meet a specialist was I was losing a lot of weight. So within a span of 2 months, I lost around 20 kgs. So around from 50,
Oh,
I became 30 kgs within a span of a month, which is not normal. You don't lose that much weight in a month. And
yeah.
I couldn't eat anything. I would eat and automatically want to puke. I couldn't keep down food at all. And I was really tired, lethargic, a lot of stomach pain. So for any individual, the first point of contact is a general physician. You go to a GP initially, because you don't really go to a specialist without first going to the GP. So when we went to the GP, I was initially diagnosed with anemia because my iron levels were really less, but they didn't really try to understand why I was anemic. What was the root cause of this anemia? So they put me on iron supplements, and that triggered my Crohn's even more, because iron tablets are very harsh for individuals who have any kind of intestinal problems. Even if somebody with ulcers take iron tablets, it will cause flare for them. So because iron tablets are very harsh in nature. So when things were not getting better, my iron was also not improving because I was still losing a lot of blood and we couldn't find the root cause. It's when my GP referred me to a gastroenterologist. So gastroenterologist is a specialty where they look at any of the intestinal area or anything related to the stomach, your intestine, your liver, all those kind of areas. A gastroenterologist looks at it. So they did something called an ultrasound where they could see some abnormalities in my intestine. Then they did something called a colonoscopy. That is where they found out that I had something called Crohn's disease. So I was diagnosed when I was 18. I just turned 18, so in the year 2016, and I just started my undergraduate degree. So that's when I was diagnosed with it. Honestly speaking, I was relieved that I finally got a diagnosis. So at least now we can start with the treatment, because all this while it was like, what is happening? You didn't really know, you didn't have like a proper answer to it. But the moment my doctor said this is something chronic, it's lifelong, I think that's where it took a lot of time to accept it, because as a young adult, you don't want to be labeled with something which is lifelong. You don't want to be sick your entire life. So I think that took a lot of time to accept, okay, this is something that's forever, it's for life, and you can control it, but there is no cure for it. Yeah.
So, what was your way of coping? What were the things you did in order to understand that and to say
Mhm.
that you move from, surprise to anger to acceptance? Or you may
Yes.
not move towards acceptance, but what is that journey like?
So for me, because I was into psychology and stuff, I was into therapy. I chose to go that field to get to that stage of acceptance. So I could accept it fairly easily. But however, for a lot of individuals, acceptance, they still cannot accept the fact that they have this illness. But in my head, there was just one thing: I can either accept and fight this battle, or I can just wallow in that self pity and be like, why did this happen to me? Because there's no answer to that. Why did this happen to me? You don't really know. At least I can accept and move on. So at least I can figure out how to get healthier. It's a lifelong battle. I have to live with this, all that is there, but I can still make the conscious decision to become healthier, to abide with my treatment. Because the moment if you don't accept, you will also restrict your treatment, because you will not accept there's something wrong with you. You will not really adhere to the treatment because you don't want to get into that entire process. So for me, to just say, I just want to get healthier. I don't want to be this sick, skinny girl who cannot enjoy her life. So yeah, I think that
Okay.
was the process.
Okay. Okay. So it has been a long journey, but you have come out of it and reached a point where uh, you are now providing help to a whole lot of people who are battling their own conditions. So are you seeing more mental conditions that arise out of physical ailments, or are
Yes.
you looking at mental conditions that arise because of whatever, because there is a
Yeah.
problem?
I think both ways. So although like my career is still oriented with suicide prevention, this is something I do as a personal growth for my personal satisfaction, as personal advocacy. So I'm a patient advocate for IBD as well. So I think a lot of individuals, especially medical practitioners, they fail to understand the relationship between your mental and physical health. Because the moment you have a chronic illness, not just IBD, anything, even diabetes for that matter, there is a significant mental health impact. People are suffering mentally because some of them go into depression, and there's something called health anxiety. The moment you have a health condition, you develop health anxiety, you develop something called health post trauma stress, health PTSD. So PTSD usually is considered as, it's a traumatic condition, right? Usually it's associated with the army veterans. You associate that with them, or you associate it with child abuse, childhood abuse, and things like that. But a huge part is also, if anybody has a very severe health condition, they're very likely to develop health PTSD because of the medical gaslighting, where you've been told there's nothing wrong with you, but there is something definitely going on with you. Tests show things are normal, but you can physically feel things are not right. And doctors putting the blame, there's a whole I think trend going on where patients are blamed for their condition. But who would really want something like this? So I don't understand why medical practitioners end up blaming patients for things like that. Nobody wants to fall sick, right? Nobody wants to be ill. So it's not like we're doing something just because we want to be, just because we want to be sick. So there's a lot of medical gaslighting, and there's a lot surgery and medication side effect, which causes a lot of trauma. So there's a huge mental impact of having a physical illness. And you even and it's vice versa condition. So if you're stressed because of this, you increase chances of flare up, because stress, as we know, has a direct impact with your physical illness. Even for individuals with cancer, they say a primary reason why individuals develop that is stress. So when you're stressed, you develop flare, and if you have a flare, you're stressed. So it's a very vicious cycle that
Right.
individuals are in. So I think
Right.
that's where therapy comes in, to help them cope with the mental health part of it, so that their physical symptoms slowly reduce. So I think that's where it comes in.
Okay. So I'm talking to Malvika, and in the next section, I will be getting into suicide prevention. Some questions. So anyone who is all the standard disclaimers would apply, because I think having Malvika on board, and given that she's in the field of suicide prevention as well, I'd like to understand her perspective from a lot of things. Uh, so Malvika, what is it that in terms of suicide prevention, how does it present itself? Is it normally after an attempt is made, or is it after there is an indication from the family that something is not right?
Mhm.
How do you go about handling a condition like that?
So right now, the area I'm working in suicide prevention is more around training individuals in this area. So I don't really see clients one on one. I'm not trained in seeing clients one on one who present with suicidal conditions. But suicide prevention actually comes way before the suicide attempt has been made. After the attempt, it is something called postvention, which is also a part of suicide prevention, where but I'll come to that later. But suicide prevention has to start way before an attempt has been made. So actually, individuals who are suicidal, 8 out of 10 individuals who are suicidal will display warning signs. They will show signs that they are very soon to make a suicide attempt, or they're not doing well and they really need that help. It can be something as simple as isolation. if somebody was a very jovial person and suddenly they're very isolated, they're keeping to themselves, they do not want to interact with the outside world, that's a big red flag that, you really need to pay attention to them. Individuals who have chronic illnesses, they are very high, they are one of the high risk populations for suicide. It's very high, the high chances that they might have a suicide attempt. So it's very important to pay attention to them. Individuals who have gone through a recent divorce, or they've been expelled from school, or recent big changes in their life, who have just moved countries, things like that, they are high risk for suicide. So individuals, these are high risk individuals of suicide. And sometimes very casually people make jokes, okay, I just wish I was dead, I can't deal with life anymore. Sometimes that might not just be a joke, they're actually seeking help. That's actually a verbal warning sign of suicide. So what we do is we provide something called suicide prevention gatekeeper training. So where we train individuals to identify the signs of suicide in their community, amongst their loved ones, persuade them to seek help, because people will be a bit hesitant to seek help because suicide is still very stigmatized. So automatically, they wouldn't want to seek help, or they wouldn't want to open up about it. So we train them to persuade individuals to seek help and refer them to mental health professionals who are trained in the area of suicide prevention. So I think the first step for suicide prevention actually is to talk more about suicide. We need to have,
Right.
as a community, we need to have more open conversations about suicide. In 2017, India has decriminalized suicide. So suicide is no longer a criminal offense. I think that is something we all need to get into our heads. Suicide is not a criminal offense. So it's high time as a community we start talking more about suicide. We start talking about the complexities about suicide. It's only then will individuals want to open up about seeking help, for this. So that's
Okay.
where it starts.
And typically, what you're currently doing is working with people. Sorry, can you expand on what your function is
Yes.
in what you do?
Yes. So I am associated with an organization called QPR Institute India. They are the Indian arm of an organization called QPR USA. So QPR refers to question, persuade, refer, where that's a type of suicide prevention skill. So we deal with organizations, educational institutions, where they train a large group of members in something called gatekeeper training. So recently we had trained IIT Kanpur. We train their professors, students, wardens, security guards in this gatekeeper training, because I think IIT as an institution has very high rates
Yes.
of suicide
Yes.
in it. So we train individuals to spot the signs of suicide amongst their students, amongst their staff, and then intervene at an early stage, because if you can, early identification is early prevention, because you identify something early, then you can automatically send them to seek help and you can prevent a suicide attempt. So that's where our organization comes in place. We train institutions to prevent suicide. We train them in this gatekeeping method. Gatekeeping is a World Health Organization recommended strategy for suicide prevention, where gatekeepers are like super community members, in a sense, where they can spot individuals who are displaying warning signs of suicide. So we train individuals in that so that they can spot these people in their community and provide early intervention for them. So that essentially we come at the suicide prevention stage.
Okay. So, what is the response to this kind of training? What are
Mhm.
the experiences of actually going through the training, and what is the pushback and the feedback that you get?
So surprisingly, organizations like IIT are hello.
Yeah. No, there was
Yeah.
a slight glitch, Malvika.
Yes.
So you
Yeah.
probably have to repeat whatever you said
Yes.
about 10 seconds ago. Yeah.
Sure. No worries. The IITs, they are really they themselves are coming forward and seeking this training, because I think the world can see now how significant suicide rates are with these institutions, and I think the government is really forcing them to get things like find a solution to this. So bigger organizations, yes, they are pretty open to this. However, at a very smaller level, people are like, we'll first deal with basic mental health issues and then we will come to suicide. That's the idea for people right now, because I think mental health in general is stigmatized. They're like, no, we don't want to talk about suicide, we don't want to scare people away about this. So they're like, we'll deal with these lower mental health, the term at lower mental health, things like anxiety and things like that, and then if needed we will come to suicide. So I think there is a lot of pushback still in our community because people don't want to talk about suicide. because there is this myth going on. If you talk about suicide, you're planting the idea of suicide in somebody's head,
Okay.
which is not true. The research shows that when you talk about suicide, you reduce the risk of suicide. So if you have an open conversation about suicide, and you know how suicide prevention and things like that, somebody who might be thinking about suicide, they'll feel motivated to seek help. But in our culture, there's this myth that no, you can't talk about this, is a hush hush topic, we shouldn't talk about these things, because then what if because of us somebody does attempt suicide. So I think that's a pushback. And also I feel our media has to really get on with the terms that they use to describe suicide and the things that they show about suicide, because I think the tagline becomes something like this, right? Just this one, the father did not allow this daughter to do this, because of which she died by suicide. But they don't even use the term died by suicide, they use committed suicide. But we should no longer use the word committed when we talk about suicide, because suicide is not a crime anymore. So the moment we attach the term commit is to do something wrong, to do something against, because we say commit a crime, right? So automatically we're attaching that stigma to suicide. So when these news channels are portraying things like one small reason this person committed suicide, they're really underplaying the complexity of suicide. So in one of our Gatekeeper trainings, the instructor very beautifully gave this analogy about suicide, where during the 9/11 attacks, those who were trapped in that building, they had two options: either be burned by the fire or jump. So now those who chose to jump, is that called suicide? Maybe not. Maybe it is just that for them, burning was so much more painful that they chose to just jump. So individuals who choose to kill themselves, for them their life is a battlefield. Their life is so difficult to live, they choose to kill themselves. So it doesn't mean that they're just doing it for the sake of it. Life has become so unbearable for them. So I think we have, as a community, we have to see why these things are happening, why suicide rates are increasing in India right now. The student suicide rates have crossed the birth rate in suicide, which is a very alarming situation in India currently. So we really need to talk more about it and see where, as a community, we are going wrong. And news channels really, I think it's high time they become more sensitized to it. They train. I think media channels need to do gatekeeper training mainly, because they really need to be very sensitive about reporting, because media is the first point of contact for all of us. We see media and we believe what media tells us, right? So the moment we attach to stigma at a media level, automatically individuals will stop talking about it. So I think media channels have a huge responsibility to deal
Right.
with this.
So, Malika, what is your response to, let's say, people from my generation, where it
Mhm,
was supposed to be that young people today are a lot more delicate? They are
mhm.
not really, they don't have the mental strength that the earlier generation had, which is, one way of saying that we were stronger mentally. Or is it simply that you've got to understand what people are currently going through and
Yeah.
show them? So, what is your response?
So earlier, where there was not much awareness about mental illness, which is why it seems as though our generation is more delicate, because right now we are all aware of mental health. We are all open to talking about it. And if something is wrong, we are okay to stand up against it. I think there's this whole narrative, right, about the Gen Z, that if we don't like something at the job, we leave it immediately and things like that. Our tolerance level is very low. I feel we have seen this from our older generation, where you guys have tolerated everything in life, and we see the implications of it. And we as a generation want to break that generation trauma. We are saying, no, if something is not okay, it's not okay, and it's fine. For us, our mental health is more important than anything, and there's nothing wrong in that, right? I think your generation had glorified working, I feel, where work became life. But we have to understand work is just a part of your life. If you're 24/7, you're only about work, 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 what exactly are you doing in your life? After retirement, right now, we don't even know if you're going to live that long. And after retirement, you're just old and sick and ailing. Where are you enjoying life then? So all this money that you're saving is going where it's of no use. So I think our generation is okay to be more we our self-care is quite important for us, because we need to live in the now. Not saying that hard work is not important, not saying you shouldn't. There will be things at your work where you sometimes will have to keep quiet and you will have to deal with it. But I think as a generation, we are more open to saying if something is wrong, it's wrong. We're okay to stop it right then and there. So yeah, I think that's where we differ. And also there's a lot of competition in this generation where if you look at the even if you look at the current work situation, there's so much competition, and if a person has a job, it's a big thing in this economy for someone to stick on to a job, because I feel job hunt, finding a job is becoming so difficult. And if somebody is talking about it, we're automatically deemed as, delicate and things like that. But I feel there is a lot of competition we face right now than maybe your generation would have faced. I think things are really getting more difficult in this. That's where we are not delicate. We are dealing with a lot of things, and we're okay to talk about it and stop. We don't want to carry that trauma to future generations, I feel. So yeah.
Okay, great. So you're listening to My First Job, the podcast. I'm talking with Malvika about her journey into forensic psychology and suicide prevention. And now we'll get down to the more mundane aspects of what does it actually mean to pursue a career in psychology. And be asking Malvika in the next section about what a career involves and the salaries and what are the things that she likes about doing it and what things that she dislikes about doing it. So, Malvika, what is it that you have found is nice, not so nice, mundane about what you do?
I think the best part about a profession in the mental health field is you're truly making a difference at a grassroots level. You are changing lives of people and you are helping them be at their best potential. I think that's the best part about it. And also understanding the human mind, it does give you upper hand. I think psychologists, we're really good at analyzing and observing people. So I think we do have an upper hand than the lay population of judging a person as to how they are, and by the way they talk and things like that. However, I think only if you're truly passionate about this field, choose this field, because it's a very, very slow field to grow in. It's not like engineering or finance where you graduate and like this, you find a job and like this, you are paid. No. Only if you're truly passionate about psychology, choose the field of psychology. It's not an easy field. People think psychology is very easy to pursue. No, you have to study a lot in this field as well. You have to keep studying. You have to keep researching in this field. Job opportunities are in India. Yes, there are a lot of job opportunities, but there's also a lot of competition, and we are paid peanuts in this field. In India, especially, you're paid peanuts. So, if your ultimate goal is to become very rich very soon, this is not the right field, because of course, I'm not saying you cannot make money in this field, you can, but it's a very slow and long process. Probably in your late 30s is when you will be financially secure in this field, which is not like other fields, right? So if making money is the primary goal, then psychology is not the field for individuals. I think that's also a very annoying part for me, where right now I'm like, I want to make money as well, but paid really less over here. So one thing what mental health professionals, they do is they're working in a private company, or they're working in a company, but they also see clients privately. So in the weekends when they have spare time, you can see clients privately. So you also make money through that on the side. And I think in India, that's also allowed. A lot of individuals in this field of mental health, they go into research, and I think research is also where you're paid a bit more. So you can also go into research, and you can also go into corporates and organizations where you are involved in the hiring process, or there's something called EAP, employee assistant programs, and a lot of big organizations, they have that. So you're involved in there, and there you're paid well because you're part of corporates. So I think you have these different avenues. Research is a very great way of going into of pursuing a career in psychology. And I think there's a myth that in only one-to-one counseling is the only career outcome of doing psychology. But once your psychology gives you an upper hand for a lot of things, a lot of individuals are also going into marketing because they have really good people skills. So they go into marketing post a career in psychology. They go into customer service. They go into HR because your people skills are really strong. So you can really go into these fields if one-to-one counseling is not what you're interested in. You can go at a policy level where you work with government, where you sit down with them and you work on policy level at grassroots level. For that, you have to go into research. So I think psychology is a very vast field. So if you choose that, don't just stick on to this one-to-one counseling. You can really explore career opportunities in psychology because your people skills get really strong with psychology. So you can always pursue a career where interacting with people becomes your main primary goal. But yes, you're paid peanuts initially. It's a very long journey to become successful in this career. So only those who are truly passionate about psychology should choose psychology.
Great. I'm glad you're being so frank about it. So, what is your way of dealing with the days on which you're low, and we
Mhm.
all go through those phases when we say that, hey,
Yes.
nothing much is happening, or something that you put a lot of effort into doesn't seem to materialize.
Yeah.
So what is your way of coping?
So I think one of the first things I do is tell myself it's okay not to be okay. It's okay you're going through these things, and I don't try to put myself down. There's this narrative they are going through difficult things, then you shouldn't be cribbing. But I'm like, no. Sometimes as human beings, it's okay to pity yourself. It's okay to think, why is this happening to me? I know we have to be a bit more kinder to ourselves. So that's what I do first. Then I have a habit of journaling. So I journal my thoughts. I journal daily. I journal when I wake up. So when I wake up, I say thank you for waking up, and I journal how I want my day to look like. Towards the end of the day, I reflect what has gone right today, what has gone wrong. And I also simple things like one thing I was grateful for today. I think that really pushes us, that forces us to think about what went right today. It can be something so small as today the stranger smiled at me and that made my day. I think as human beings, we are so used to looking at the negatives in life that we really, let go of the positives. So maintaining a gratitude journal really forces human beings to look at the positive that is there in your life. Something so small as somebody smiled at me, or this person opened the door for me, or in something in a city like Bangalore, I got an auto without being cancelled. I think that was something I was grateful for today. I think that is something I really looked at. But on days when I'm really down and where I cannot really think of anything else, I read. So for me, reading is an escape from reality. And I feel that is a very healthy coping skill for me, because when you read, you're in this alternate universe altogether. So I think reading is an escape from reality for me. Similarly, people like to binge watch shows, that's an escape from reality. A lot of people find cooking very therapeutic for them, they do that. Or just simply, there's something called bed rotting, where you just sleep, you're just in your bed, not doing anything, not moving at all. And that's also fine. Sometimes we really need that bed rot session. You just want to escape from everybody, not interact with anyone, and that's completely fine to do that. I think
What
just do
about
what you want.
conversation with friends? Is that an outlet, or
Definitely, that's an outlet. I think venting to friends is a great outlet, but we should also understand if our friend is in that mental capacity to, so that we can dump our things on them. I think we take friendship for so much, we take it for granted, where we don't even check with our friends, hey, I'm going through this, is it all right if I dump things on you? Because we don't know what they're going through, right? But yes,
yeah?
having supportive friends and I'm grateful for the friends I have. I think friendship is so pure, so unique, that there's someone there for you. They're not going to judge you, and you can just call them at 3 a.m. They'll pick up your call, and you can just vent out with them. So yeah, venting to friends is a great outlet, but also check on your friends if they're okay, if they're in that mindset at that moment, because we don't want to trigger something for them, right? But yeah, mutually
Right.
discuss with each other. Yeah, that's a great outlet.
Great. So, in conclusion, Malvika, any closing remarks, anything that you'd like to say?
Yes, so for those youngsters who are pursuing a career in psychology, I would mainly say be patient. And I think there will be moments where you doubt yourself and you doubt if this is the right career for you. Also remember, life is long. You can always choose a shift in career, especially nowadays you see people changing careers at 60, and that's completely fine. And especially take your 20s to explore what you like, explore different domains. Like I started neuropsychology, I'm in forensic psychology, in health psychology. So I think I've explored so many different things. I think your 20s are really, take the time to explore things, make mistakes, and that's completely fine. And don't let others dictate what you should do. If you're truly passionate about it, believe in yourself. It will take things, good things take time. Things will take time, but at one day you'll go back to the journey and you'll be like, that made me the person I am today. So just enjoy the process, I would say. Enjoy the journey.
Great. Thank you very much for coming on the show, Malvika. It's been a pleasure
Thank
talking
you.
to you. That was Malvika, and she's into forensic psychology, but she currently works with suicide prevention, and she's doing a lot of very interesting work. So next week we'll be back with another guest, another show. Until then, subscribe, keep watching, share, and let your friends know that here's a way in which you can find the career of your choice. Thank you.